This is Gary Atencio with CNTV, and today we're in California. I am here with ConnectWell. Since 2010, this leading edge provider of digital health and wellness engages people in their total health and well being with science based content that is designed for a consumer audience. I am joined here with the CEO and founder, Andrea Bloom. Thanks so much for joining us here today.
Thanks for having me, Gary.
I'm going to start off a little bit about yourself. You were formerly educated at University of California, Berkeley, as well as Harvard Business School. Your experience is vast. I mean, you're working with innovative leaders who are redesigning healthcare delivery for conferences as well as nonprofits, as well as an author of articles for a wide range of publications. I want you to share with us a little bit how your background led you to an aha moment in 2009 where the passion to flip the paradigm of healthcare by placing the consumer at the center began for you.
Great. Well, thanks for giving me this opportunity to explain that. So after graduating from Harvard Business School, I started working at Johnson and Johnson in their diabetes device business, and it was a very exciting time. This was a long time ago, before what was called the diabetes epidemic. So I was helping develop new products, bring those to market to help people with type 1 and type 2 diabetes manage their illness. After launching that product, I helped bring products to developing markets where they previously did not have diabetes testing devices. So it was very exciting. And I felt like I was doing something really, really good for people. And that was my background. At that time, when you're hired to work for a company, they kind of own your brain. You think based on supporting their goals. How are you going to grow the business, grow market share, increase profits, and add shareholder value? So we were just going along with the natural paradigm of healthcare, which was kind of treating the symptoms rather than the root causes of illness.
Interesting. I think that's something that most of those companies are built on just like that. And when you're so caught up in it, you don't even step back and think, is there a different way? Is there another way we can serve people? You did that. We live in a digital age of information. It's really at our fingertips 24/7. Yet with an abundance of data, the consumer can be overwhelmed. Is our health far too important to simply leave to a Google search?
That is a great question, Gary, because not only have people going to online searches, now they're going to AI platforms, and it is very, very serious. Now, the problem with going to Google searches is that the searches are heavily influenced by display order, and display order of results is heavily influenced by advertising, paid placement. Most people will look on the first page of a result, and so it's incredibly biased, and there's a lot of misinformation out there. Also, when you do a Google search, your browsing history is traceable, and that leaves people very vulnerable to more advertising and just preying on you and on your vulnerabilities. You're sort of exposing your health issues out there. Remember, the internet's like a tattoo. It stays there. It's a digital tattoo. People don't realize that. And now with AI, people just input their queries about what their health issue is, and then AI platforms scrape the internet, and whatever is out there, they pull in and give you the result, but it doesn't validate the information as science-based.
I mean, validated information. I mean, as consumers seeking information, we are surfing for sources that we can trust. Yet, would you say that most fall short and are left to kind of vet the info themselves? And why can that be risky and maybe even dangerous when you're talking about our health?
Oh, Absolutely, because you may not know where it's coming from. And in addition to that, very, very few people can do really good internet searches for health information. And when you get to the site that you want to look at, it may be written in a very high reading level that it's very hard to understand and digest. It may be written for a medical audience, not a consumer audience. So it's very challenging, and you may have to click on other links and then look at sources. It's very complex, and that's why that's not the best way to get health information.
Definitely not, but yet we're doing it out there. That's why I wanted to educate people. I mean, your company, you began this 14 years ago, but it's prime and perfect right now. We're talking about AI and everything everyone's doing. As the founder, you realize the need for a one-stop suite of reliable and vetted information. How did this idea kind of come about? Explain that for us.
Okay, so it was after I left the corporate world and started my own medical device healthcare practice where I could really think independently. And I started working with a variety of medical device companies looking at a more than the diabetes disease state. And I started seeing how much illness there was out there. As part of what I was doing, I was a volunteer at Bearskin Meadow Diabetes Camp, where I was there to observe the parents and the children with diabetes and see how we could come up with other devices to make their lives easier. So I was in an immersive experience, almost living as a person with type 1 diabetes myself. So when I was participating in the educational forums with the parents, I had my aha moment because these kids need so much care around the clock on testing their blood glucose, giving themselves insulin and what they're eating, but they were thriving. And it's because the parents and the children themselves knew self-care practices for their illness. I
Wow.
know. So why, when we're born with these perfect bodies, do we make ourselves ill? These kids didn't have a choice. They just got this autoimmune disorder. But so that's when I thought, okay, if we can teach kids with this illness and their families to take care of them, we can teach everyone these self-care practices.
A wide audience. You turned that microcosm of what you've seen working and said we can do this across the board. ConnectWell selectively curates health content from trusted sources to provide the latest standard of care guidelines and scientific findings. Who are some of these content providers that you tap into and partner up with?
Great. Well, thanks for asking about that. So we have our own team, and we're very, very well versed in writing content and vetting it and having it medically reviewed. We also incorporate Mayo Clinic's health information to access this world-renowned content and integrate it into our dynamic platform experience. And part of our experience includes engaging visuals. And that's so important to pull people in, and having the right font size. Things may seem small, but it's very important how it's laid out and how we design it for easy searchability. We also incorporate UCTV videos from University of California TV into our platform. So basically, we bring the experts to the end user so that they can engage in their health and well-being. And with our wellness initiatives, which are all about lifestyle medicine, designed with our scientific advisory board, we teach people healthy habits so they can live well.
It's fantastic. I mean, you're a conduit. You're the hub where all these sources are coming together. I mean, so these providers are vetted. They can be trusted. I mean, one of the most trusted names, like you say, is the Mayo Clinic. Was that important that you integrate their renowned content into your platform?
Absolutely, because the Mayo Clinic is an esteemed medical academic center, and they have specialists across the board. And because we can incorporate that as new treatments come out, then that pulls into our platform. We connect to their application programming interface, pull it into ours, so it's updated continuously. So that's really a great partner, as well as UCTV, which covers programming across the 10 University of California campuses. How many people can actually hear from a UC San Francisco doctor? But they can now with our content and go at their own pace, digest the information. People have very limited time at the doctor's office these days, and so they need
Wow.
outside expertise.
That is exciting. I mean, obviously, your proprietary design elements bring health information to the consumer as a user friendly feed that can be easily accessed with over 40 health conditions. Kind of explain how that easy access works. What are they going to find when they go and click on? Explain that.
Okay, great. Well, so it depends on who our partner is. So our partners, which are customers, we call them partners because we partner with them to build the design they want to reach their target audiences. So our partners may be pushing content. So in fact, if they are a digital therapeutics company, that's an exciting term, digital therapeutics, meaning instead of just giving medication to someone, you're health coaching them on their illness. And let's say you're coaching them on diabetes. The coach would be pushing content based on that conversation they had as part of their care plan to do in between the coaching sessions. So that's highly personalized. Other ways is we are on corporate wellness platforms that companies build as part of employee benefits, and we would be a tab inside the platform around education, and that's sort of the self-serve model where the end user, the employer, can go and there's beautiful icons that are very visual, so you know exactly where to click, and then you can find your article.
That is exciting. I mean, a lot of moving parts on the back end, yet it's really simplified for the front end user because it's customized really for them. I mean, this is a full collection that covers 95% of most conditions, and it's easy to understand, beginning with the basics. Then you go more in depth with easy to use icons. I mean, really anyone can use this, from young adults to the elderly. Is that what you find?
Oh, absolutely. I mean, we've been told that the user interface is so easy to use and there's nothing like it. And honestly, the readability makes it so easy because if something's very hard to read, you get lost. We use medical terms, but we explain what they mean because we treat the end user with respect. Their doctor's going to be talking about their health condition using very high level medical terms. So they need to know what those terms are, but then we explain it in plain language and then give them a variety of ways to help manage their condition because there's usually not one way. People need to see the options and be empowered to make the right choice for them.
When we are given the proper information, then we can make a decision based on that information. I mean, really, it's as simple as typing in a keyword to be connected to your scientific advisory board. I mean, they represent leaders across the spectrum of health and wellness. I mean, I imagine this is far more than we could ever get from our primary doctor.
Well, that is a really good point, Gary, because honestly, most doctors aren't trained in nutrition in medical school. They're given like an hour of training, and a majority of preventable illnesses are related to food and beverage consumption habits. So this is so important. And oftentimes people go in with sleep issues or mental health issues, and doctors will go, okay, well, why don't you try this sleeping pill? Well, guess what? We teach people sleep hygiene. That is, there is a role for medication, but there is another role for lifestyle. So we give people the range and we want to empower them to help improve their own health and well-being.
As a parent who has had children who've been diagnosed and I'm lost, I'm not sure how I can help. I feel like I'm Google searching. I'm going, this could be ridiculous because who knows what I'm even coming up with. That really gives some peace of mind, not only to parents, but also to the folks that are going through these situations as well. I mean, not only health issues are addressed, but also for staying healthy. What will they find in the way of prevention and being proactive with wellness?
Okay, well, prevention is so important. So if you typed in the keyword screenings, then you would find out what screenings you need, like blood pressure, cholesterol, cancer screenings, those diabetes screenings, pre-diabetes screenings, when to have those really important screenings, and then what those tests mean. Vaccinations, making sure your vaccinations are up to date. Also, just staying current with new vaccines. There's a new RSV vaccine, and our content explains that. So that's really important. In terms of staying healthy, we have exercise programming on our site, and for mental health, we have audio meditation. So you can do that anywhere. If you have a break at work, or you're on vacation and you want to do an audio meditation or an exercise program, it's right there at your fingertips, and it's great on mobile.
I love it. I mean, I love that the content is individually crafted with the consumer in mind. I mean, it appeals to a wide audience, it's engaging, it's visual, it's even multi-language. Was wide use important to your mission?
Oh, absolutely. We are a mission-based company, and uh, our goal is to democratize access to health and wellness information and scale health literacy. And we do that through organizations that need to bring this to their populations. Everyone needs access, regardless of what socioeconomic status they have, whether or not they have employer-sponsored health insurance or they're on Medicaid or Medicare. Everyone needs equivalent access. And also, there's a big portion of our population where English is not their first language. And that's why this multi-language capability is so important. And also our videos, we have closed captioning, for people with disabilities, people who are deaf. And then also, if you want to change the closed captionings to other languages, then they can also learn direct from the experts.
Yeah, that is great. I mean, obviously, this is built for the end user, the public at large. Before we let you go, share with us how other professionals can get involved. I mean, those who need a trusted source for their clients. We're talking from health providers, coaches, libraries, even health clubs. Tell me how they get started with you in that way.
Okay, great. Well, they just have to reach out to us, and then we start building a platform that's going to work with how their end users access their portal. And it's very exciting because, and we treat each partner uniquely. So we try to understand what their goals are. And there's different ways of incorporating our content into their site. With our application programming interface, they have a lot of flexibility to design it. If they like our site as is, we can make a custom one for them. And then boom, the iframe literally takes like less than a minute once they open a new field, and then it populates in their portal.
So you really build out that point of contact with their branding almost right there, ready to go. I mean, the current topic, like we said earlier, is AI. It's everywhere. It can be fun. It can be entertaining. It's useful. But when something as critical as our health, I mean, definitely AI should not be our sole advisor. I mean, that's really what I want to get out there to everyone, to understand that you have to have a place that you can go to that is bringing in information from all different areas so you can make a great choice. I mean, according to a report, only 12% of U.S. adults have proficient health literacy. By providing access to accurate, easy to use and understand information, we can protect and promote our health. I mean, that has to be exciting. What has been your response from some of the users?
It's incredible. I remember one woman saying, when I read that article on mild cognitive impairment, it was so helpful because I took my mother to the doctor and they did that same test on her, and I knew exactly what to expect. Another person said that article on bladder cancer was so helpful because my father had bladder cancer and me and my three sisters were caring for him. So I shared the article with all of them and we were ready to go once he was discharged from the hospital. He knew exactly what to do. And those are direct from end users, but our partners are so thrilled because they're able to scale what they're doing with their audiences, whether it's health coaching, digital therapeutics, employee wellness, and they're so excited because it crosses so many health conditions.
Yeah. Yeah, I think it's exciting. It's a win-win no matter who is using the platform. Andrea, your passion is helping people live better lives by empowering them with real-time digital access to health and wellness information that really is free of bias. This shift for you to disease prevention and chronic disease management is now really your legacy to leave for others. Is this rewarding work for you?
Oh, it is so rewarding. I'm so energized every day, and the other companies I work with who are also flipping the paradigm together, we're really working hard to move our healthcare system to a more holistic focus and preventive health focus, and just unlock vitality for people. The healthcare system is really struggling to care for the population, and we are at a tipping point where there is now momentum towards this. There's no other choice because also our society is spending so much money on healthcare services that aren't actually helping people get well. So there's a big appetite for this now, and it's really an exciting time to start really empowering people to be an equal partner in their care and to have agency over their own health and well-being.
Yep. I feel the timing is perfect for your organization. You've been around over a decade easily, but the timing is perfect right now. I think people are ready for this type of thing. Viewers, let's take a look at the bottom of the screen right there. What you're going to see is a website. On the website, you can see all the resources they provide, really as your one-stop suite of health and wellness. Once again, that is ConnectWell, integrating wellness into life. This is Gary Atencio with CNTV. And if you don't know, now you know.